let's talk about sexual dysfunctions in general. We've almost all heard about erectile dysfunction, which is where you can't get or maintain an erection. But there are a whole host of issues that men face when it comes to functioning sexually. This is because men are really complicated sexually. The act of arousal, getting an erection, ejaculating, orgasming, all that kind of stuff is incredibly complicated. It involves molecular biology, cellular biology, it involves wiring in your nerves, hydraulics in your blood vessels. It's really complicated, and this presents an opportunity at every turn for guys to have problems. Let's go over the most common problems that guys can have. Some of them, I hope, most of them, you never have to deal with. But guaranteed there's somebody watching who's going to go, oh my God, that's me. We can start with erectile dysfunction. That's where you can't get or maintain an erection for sexual activity, whether it's masturbation, intercourse, oral sex, whatever. If you can't get or maintain an erection, you have erectile dysfunction. Okay? We'll talk about all those things later. The most prevalent sexual dysfunction is premature ejaculation. That's basically where you ejaculate faster than you want. It's a pretty open-ended definition, granted. If you ejaculate faster than you want or faster than your partner wants and it's bothering you or bothering your partner, then you get to call it a problem. At the other end, we've got delayed ejaculation, which is where it takes too long to ejaculate. This can cause problems because guys will be like in a vagina thrusting away and their partner's going, ow, it just hurts and it's been 45 minutes. Are you done yet? That causes a problem. It should not take 45 minutes to reach climax, okay? There are other issues that are really puzzling. Low libido, often caused by low testosterone. Not always, but usually is caused by low testosterone. This is where a guy just simply has no sex drive or a very low sex drive. Instead of feeling the need to masturbate or ejaculate or have sex, they'd rather go fishing. Low libido is a really complicated issue. Low testosterone, it's caused by a million things. The food we eat, the water we drink, the stress, the air we breathe. It's also low testosterone causes a whole host of health issues. Osteoporosis, it can contribute to heart disease, obesity, diabetes, all kinds of complications. It's bad to have low testosterone. Next, chronic pelvic pain syndrome is amazingly common. Some people think 20% of all men have some form of chronic pelvic pain syndrome. What's that? It's often called chronic prostatitis by doctors. It manifests itself with urinary urgency, frequency, urinary thin stream, stop, start, a lot of dribbling at the end, perineum or your taint or down that area down behind your balls, that can really hurt. We have guys who it hurts a lot when they ejaculate, or they have pain at the tip of their penis, or pain at the shaft of their penis, or pain in their scrotum, or one side or the other. Guys who have constipation or diarrhea, or both, or they can feel that they're tightening up down there. This problem is huge. It causes a whole host of issues that doctors go, there's nothing wrong with you. And yet guys are going, wait, my penis is retracting. I've got hard flaccid. This is miserable. That's a really big problem. We have another condition called ejaculatory anhedonia, sometimes called sexual anhedonia. That's where you just get no pleasure from sex. You feel no orgasm. You ejaculate, you have an erection, everything works, but you don't feel good. That is a really frustrating problem for guys to deal with. It's treatable. Cures are hard to come by, but we can usually get improvement. There's another really mysterious condition called post-orgasmic illness syndrome, or POIS for short. That's where guys basically feel like they've got the flu after they ejaculate. They're not sure why it happens. There's a doctor in Amsterdam who did some study. The current theory is that the body has an allergic reaction when the sperm mixes with the seminal fluid, which mixes with the prostatic fluid and is ejaculated out of the body. It sounds really kind of crazy, but the body is often allergic to itself. We have autoimmune disorders all over the place, and the thinking is that this is just one more situation. What happens is the minute you ejaculate, your body attacks itself, essentially. Guys get fever, aches, chills, they feel grumpy, they can't think straight. It's really a miserable condition. Another surprisingly common condition is called Peyronie's disease. This is where there's a pathological bend to the penis. It usually is caused by some injury or trauma. Often guys don't know what happened. It's very commonly really rough masturbation or really rough sex, or sometimes if they pull out of the vagina and they hit it on their partner's perineum or they damage the penis somehow, the penis forms scar tissue. And where the scar tissue forms, the penis no longer stretches when it gets an erection. So it turns into a bendy, twisty, kinked, alarmingly shaped penis. There are a lot of mental health issues. Guys are really depressed when this happens. It is very treatable. You have to go to a specialist who specializes in Peyronie's disease. But if you notice that your penis is not looking the way it used to, don't be worried. You're not alone. We can help. And then the most common of all problems when it comes to sex, anxiety. We'll talk about this in other episodes, but the problem is, in our society, nobody learns how to have sex. So everyone thinks, okay, to be a real guy and do sex right, I have to somehow look like porn. We make out, I play with boobs, I go down on her, she goes down on me, I stick it in, she's supposed to come, I come there, that's sex. No, that's porn. And it's really actually pretty hard to do again and again. And as you get older, it gets really hard to do again and again. So then we start developing like, wow, I'm supposed to be a stud. I'm supposed to have sex like they do in the movies. I'm supposed to have all this stuff. And pretty soon we start feeling anxiety about sex. We stop having fun and everything stops working. This is what people are referring to when they talk about, oh, it's all in your head or your erectile dysfunction. It's in your head or whatever. It's not in your head. It's in your bloodstream. You're producing adrenaline because you're scared. Adrenaline shuts down your penis. Simple as that. Your body's working perfectly. Sexual dysfunctions, they happen to every guy at some point, at many points during his life. When it happens to you, don't freak out. It's normal. It happens to everyone. We can take care of it.